Okay, just adding some videos to the main lecture, which you might find useful. So if we just have a look here and see that I need to now protect this wound. And you can protect it by putting periacryl on the top, cyanoacrylate, that is, periacryl, sorry. You can use a collagen sponge, but the collagen sponge is not very good because it will disappear literally in, depending on what type of sponge it's in, between 1 and 3 or 4 days, even the strongest. And you could actually put a membrane over the top, but membranes can, depending on the certain types, they're quite expensive. And so I just simply protect it with a Copac, which you've heard about, and I also, which I'll show you in the next video, and I'll also protect it with Aura Aid. Aura Aid is a special attachable wound dressing when it connects with liquid or saliva. It creates a nice seal. The seal should be protected with the Aura Aid should be protected with this is the Aura Aid, which comes out of the box. The box has got these pouches in there. It's inexpensive. You can buy it from a shop. So this is one size, and that's the size you use most of the time. Or you can use this size of Aura Aid. It's just basically a plaster, and I'm doing quite a few cases in one go. I use this this size. It comes out of a pack, it comes in a long strip, and then what I will do is I will adapt it. So don't forget the mouth is going to be wet, so I'm just wetting this area with some liquid, just to mimic the saliva, and I will then measure it. Before you actually take the Aura Aid out of the wrapper, I would actually put a little black mark on top, because once it's taken off, sometimes we can forget which is the sticky side and non-sticky side. Okay, and do not, as one of our people stuck this plastic to the soft tissue. Don't use that. Now this is going to go in, and I'd like to make it mold around the abrasures of the teeth either side. So I will adapt the Aura Aid, and I adapt it by creating like a couple of wings. To see what I'm doing, I'm adapting it to that side, and then I'll adapt the other side. When you first start, you probably just do some V's, but I will a couple of semicircular adaptations. You can see what I'm doing here. Just adapting it so it covers the socket and it will wrap around the teeth either side. There are several other ways to secure this in place later. That could be done a little bit more. You see what I'm doing, I'm adapting it, and you'll do this hands-on when you come to the course, or you can practice yourself if you want. It's not hard to do. Take it, and I'll place it on here, and I'll put my thumb on the palate, or wherever it's going to be, and I will pull this over, and I will then hold it in place. And it's not slightly reacts with saliva and it sticks down. It's already starting to stick down. It's quite tenacious when it's there, but it will come off quite quickly, meaning 1 or 2 days, if it's not actually secured down. So you can see that that's in place and it's protecting the wound. Before I might put some Blue M gel underneath. This will stick better. And I will just hold that in place for 30 seconds. Just hold it in place. And blue gel under there, that's oxygen releasing gel, which helps reduce the bacteria on top of the graft, which reduces chance of infection. That's in place and that's good. You could leave it like that, but I like to give a couple of more, make it more secure. So I will take our suture material. Now the suture material, there's different ways of suturing it. One way of suturing this down is use a 5/0 material and suture each corner, either wrapping it around the teeth either side, slinging it around, suture each corner. I'm going to show you an easier way of doing this. And then you use a 4/0. 4/0 half circle suture. 4/0 half circle suture. A half circle means what a 3/8. There's a half circle suture. Okay. So then I would go here and I would grab the soft tissue. And it would go sticking to the yes, it's come out. Suture would come out. It's actually sticking to the model upside. You saw how that went over. And I would then cross over to the palate to the opposite corner. What I mean by that is I'm trying to make a cross on top of the aura aid. So you don't come over to this corner here, you come to this corner and you do another half circle. You can see what I'm doing. I'm making a half circle. Heading to the palate. Make a half circle. Sorry, I've used the suture. That is crossed over. So let's uncross. Come through. And you can see that that suture has crossed right over the top from that side. Came out, came in, out, over, in, out, and I just now suture over the top. I use 3, 2, 1. 3 over, 2 under, 1 over. And that now has helped secure the aura aid in place, the cross suture over the top. Okay, that's quite nice. Maybe I should have, it'd be nice if it was a coloured suture. I might show one later. So it's lovely. It's over and out. That's secured everything, and it's brilliant.